Hi there, Paul Haas, physiotherapist, Melbourne, Australia. Today I want to talk a bit about our awesome V2 active tape and as a tool to support and protect muscles and tendons that overlap a joint. Now, historically we used to love using rigid tape, which is stiff, but that's more for ligaments. Sometimes we use kinesiology tape, but that's not really for support, not its primary role. Its primary role is for blood flow, pain relief, and some support, but more as a rehab tool as part of an overall treatment plan, but not just a support. So we need to find a tool that stores energy and releases energy, much like what a muscle and tendon unit does. And that's why now the choice of tape is the active tape. 4-way stretch. This new one is awesome because it has a true memory. So when I pull this, it stores energy in it, much like a slingshot, and then it slings back, or like a bungee. Energy in, energy out. So if we look down to the calf here on the camera, the normal calf when you're jumping and hopping, energy in, energy out. So we want to try and make this system work less hard with a very clever tape that acts like that muscle and tendon, which is what the active tape is doing. So let's think about this area here, the posterior aspect of the leg. Calf, there's a few muscles in here. There's an Achilles, there's a growth plate in kids, there's bursas in here, there's little bony prominences. There's a number of things that can cause pain and dysfunction where we need to offload the area. So what I want to show you is basically how the active tape is the tape of choice to do that and how we apply. Now people ask me how much stretch is in the active tape. It's about 250% of storage of energy and versus kinesiology, which is about 180. Kinesiology tape, as I said, isn't for support. It's for a different set of mechanisms. And we think about the skin and the fascia, which is covered in other talks. Now, I'll get Amy just to relax before she cramps. Now, what we want to do, we want to first clean Amy's foot because it's very dirty. That's a nice laugh from Amy. But we want to lay down a big anchor, and the reason we do that is because this tape is under tension all the time. So it's not good to have a small one because that will pull on the skin. So in the case of the calf Achilles complex, you can see here, I'm applying a very big anchor. Now, the other thing here, if we get in nice and close, if you look at the tape, you might be able to see, this is a laminated tape. So I've actually got 3 layers here. Now, generally at the end of the kinetic chain, you can have 2 or 3 layers. In children, you might not need that, but Amy's she's a basketballer, so she's tall and she needs protection of that calf Achilles. So I've chosen a 3 taping laminated system. Now, what we do is with the active tape, the joint goes into the shortened position. We just take up the slack. We don't pull the tape too much, and then we lay the tape down. Okay, this is how I do it. I make sure my anchor's really, really big at the other end as well. So we're talking about 3-4 inches. And then I ask Amy to straighten her foot out. The tape starts to take up the storage of energy, and then I massage the tape in. Okay, so we get that massaged in. Okay, Amy just to straighten out a little bit more, and we just make sure there's no tape that's bunching up. And we can see very quickly, if Amy just relaxes her foot, it kicks right back out again. So in that planar motion, the tape is storing and releasing the energy, much like a bungee cord. Now, because this is tight here, we need to protect that. Otherwise that will pop up and cause irritation and problems. So we apply another strip that supports through here. Now I'll ask Amy to straighten her foot out again so that the tape doesn't influence the actual storage of the energy. So and I'll just get Amy to lift her foot up off the table a bit for me. Yep, and that allows me to get this tape underneath, and then we create that band there. Okay, so very quickly you can see now that we've swapped one system, muscle, Achilles tendon, growth plate, with an opportunity to store that energy elsewhere, which is in the tape. Now, if Amy has a rotational issue around the rear foot, so we talk about varus and valgus movement, then we may tape differently again to deal with that. But we're showing you today one plane of motion being dorsiflexion, plantarflexion, and how the tape stores that energy. Give that one a go. It's a really, really good option. It allows mobility, but stability and support. It's the tape of choice for muscles and tendons. Active tape, give it a go.